Hi, I'm Dr. Ross Mason, a urologist and prostate cancer surgeon here in Halifax. The purpose of this video is to help you understand prostate cancer surgery and what to expect before, during, and after the operation. One of the ways prostate cancer can be cured is if the cancer cells are only in the prostate gland and if the prostate gland is removed. For this operation, you'll need to go to sleep for about 3 hours. You'll meet with the anesthesiology team a few days before the surgery and on the day of surgery to go over the details of being put to sleep for the surgery. The prostate gland can be removed in two ways. One way is using an incision made up and down on the lower belly. The other uses small incisions on the belly where a camera is inserted and a robot is utilized to help with the removal. Both of these methods are good options, and you'll discuss with your surgeon what option is best for you. The prostate gland is carefully removed, trying to spare the nerves that control erections that are beside the prostate. After the prostate is removed, the bladder is reattached to the urethra, which is the tube that allows urine to pass through the penis. In some cases, lymph node glands are near the prostate and are removed to remove cancer that might be in these nodes. As with any surgery, it is possible that things won't go as planned. There are several other structures near the prostate, and uncommonly, these can be injured during surgery. These structures include the rectum, the bladder, and the ureters, which are tubes that drain urine from the kidney into the bladder. If this happens, these will be repaired right away. Also, it is possible that more bleeding than usual is encountered, and a blood transfusion will be required either during or after the procedure. Rarely, I will see something that will stop me from taking out the prostate gland. As an example of this, if the cancer is more advanced than we thought before surgery, and I feel it is not safe to proceed with removal of the prostate won't be removed. Here's what to expect before and after the operation. You'll learn about the date of your operation between 3 and 4 weeks before the operation. You're usually informed by a letter, and you'll also be told about a pre-surgery evaluation. During the pre-surgery evaluation, you will have a few tests, including blood work and possibly a heart tracing. You will also meet with someone from the anesthesiology team who will examine you and ask you questions about your personal medical history and medications. The day before the operation, be sure to follow any instructions about your regular medications that have been provided. You cannot eat or drink anything after midnight the night before your surgery. On the day of your surgery, you'll report to the check-in location, which will be indicated on your paperwork that has been mailed to you. There will be an area for family members to wait. It is also possible to leave a number where family members can be reached. Your surgeon will talk to your family shortly after the operation is over. After the operation is over, you'll go to the recovery room where you'll be closely monitored for a couple of hours. After this, you will go to the urology ward. You will have a catheter in your penis to allow the connections to your bladder to heal and to allow urine to drain. This can often cause you to feel as though you constantly need to empty your bladder. Medications can be given to help prevent this feeling. Some patients will also require medications to help with pain or nausea after the surgery, and your nurse will give these to you. However, many patients do not need strong pain medications after prostate surgery. You will have a surgical drain in place, which is a thin tube placed in your belly to allow drainage of any fluids in your belly after surgery and to monitor for complications such as bleeding or leakage of urine through the connections. This is usually removed before you are discharged from hospital. You'll be encouraged to get up and walk shortly after your surgery, usually that night. Walking significantly helps with the healing process. Depending on your recovery and type of surgery, the hospital stay is usually 1 to 2 nights. While in hospital, you'll receive lots of teaching on how to take care of the catheter at home and on other important post-surgery details. You'll be examined in a hospital usually twice a day by a doctor, but a doctor is available 24 hours a day if any issues arise. The catheter will need to stay in place for 1 to 2 weeks after surgery. It is then removed either in the urology clinic or by your family doctor. Sometimes, the connection between your bladder and urethra takes longer to heal, and you will need to have the catheter in place for longer. Once the catheter is removed, most men will have incontinence, which is unwanted leakage of urine. You will need to wear a pad in your underwear initially, and you will receive instructions on exercises which can help decrease the amount of leakage. You will also be offered a chance to meet with one of our nurses for further help with leakage as well. For most men, the leakage improves and resolves over a few months. However, in some men, the leakage can continue. There are treatments available for this, so be sure to mention this to your surgeon if this is an ongoing issue. Erectile dysfunction is common after prostate surgery. Again, for many men this improves with time, but while the healing process is occurring, you may need medications to help with obtaining an erection. In some men, they will need to use medications or other treatments permanently after surgery. If this is important to you, be sure to mention this to your surgeon, as these treatments can be started shortly after removal of the catheter. Your first visit with your surgeon is usually around 6 weeks after surgery. At this time, the results of the pathology report will be reviewed with you. The pathology report includes information on the stage and grade of your cancer, which is how advanced your cancer is. It was possible that the cancer was more advanced than we expected, and you may need additional treatments. It is possible you would need to see a radiation doctor for their opinion about whether you would benefit from radiation therapy. It is not possible to cover everything you should know in this short video. The nurses and other staff will give you information you should review. In addition, there are additional online resources which can be helpful, such as the Prostate Cancer Canada's website. Your surgeon can provide you with this information and these resources. You can also prepare for this operation by maintaining and improving your health while you prepare for your operation. Exercise, proper nutrition, and stopping smoking if you do will help with recovery after surgery. You can make a real difference in your health, and with the great team we have here at the hospital, you have a great chance of recovering from this operation.